So in terms of what made me want to become a physician, probably a lot of different factors. Once, as a kid, I guess I thought my doctor was pretty cool. I was in the hospital a lot because I had pretty bad asthma. So that probably started it off. And then as I grew older, I decided I didn't want to be a doctor. Actually, I wanted to be an engineer. And while I was working in a small lab all by myself, I realized I really didn't like being on my own and not having people to talk to. And I realized more and more that I really liked the interaction with patients. And so I decided to go into medicine. So I'd say my personal style in patient care is you're the patient, it's your body, you decide what you want to do. It's my job to tell you what is recommended. So I'd say my style is pretty laid back. When I first meet a patient, we'll try to get them to come back at least within the next 3 to 6 months. It kind of depends on their problem or the extent of their medical history. So most of the time, if they have an extensive history, we may follow up sooner. And if it's not that extensive, I'll leave it up to them to follow up in the next couple of months. Pediatrics can be a lot of fun, but the bad part about pediatrics is the immunizations. And most of the time, kids hear that and they get a little bit anxious. My own kids are scared of going to the doctor, even though they know that I'm a doctor. So I definitely approach them with tender care and kind of make sure that they're comfortable with the idea. Usually I try to approach mom and dad first so that they're comfortable with the idea of examining and that sort of thing, because a lot of times if they see mom going through it, a lot of the kids will feel a little bit better about it. Being in family practice, it's a great experience. You get not only parents and their children, but you get grandparents and aunts and uncles and entire families, which is nice because you get to see that interaction. You get to learn things from other people and other perspectives in the family. A lot of times elderly people do come in with family members, but I try to approach it as if they are the patient. So I like to talk to them, give them an idea of what's going on and what our plan is before I start talking to their caregiver or their child or whoever's in the appointment with them. In terms of preventative care, that's a major concern for me. I think if I can do most of the preventative care for most people, I can keep them out of the hospital, I can keep them from getting sick. A big part of preventative care is getting the patient to feel like they are meeting all the challenges that they want to meet, whether that be the simple things like I want to get in 8 glasses of water a day, or I want to exercise once a week, and then build from there. And I always challenge my patients to try their best to make those small changes before they go to the big changes. I always tell my patients it's about forming habits, and those habits take time to form. So if you take small steps, you're more likely to stick with those things rather than taking a giant leap, which is much more difficult to achieve. I'd say my greatest reward is when a patient gives me a hug and says that they really appreciate my time. I think that's always the nicest feeling. And I'd say the second time that I feel that I get all of that is when I have a patient in the hospital who's passed away, and the family members really appreciate all that's been done for them, because that is the hardest time for any family, and to be a part of that and for them to include me in that part of their life is makes me feel like this job is